Amrak Institute of Medical Sciences is an allied healthcare institution affiliated with the Derns Hospital, helping individuals stepping into the healthcare industry with application-based skills. Amrak courses provide a structured pathway for individuals to become professionals by obtaining relevant knowledge and practical expertise sought after by the healthcare industry. We also provide a unique opportunity for individuals to update and enhance their skill set successfully to meet the rising demand of the job market and offer a vocational education platform to individuals seeking a career in the healthcare sector. Today, we are here to learn more about the clinical fellowship program offered by Amrak in partnership with the world-renowned Royal Wolverhampton Trust of the United Kingdom. We have Emily Worth, the program manager of the clinical fellowship program, joining with us today to talk more in detail on this behalf.
Hi, I'm Emily Worth. I'm the Clinical Fellowship Programme Manager at the Royal Wolverhampton NHS Trust and Walsall NHS Trust in the Midlands, UK. Yeah, so the fellowship programme, it's a supportive educational programme that we run. So we offer educational support to international recruits and UK recruits. It's an inclusive programme. We've got a real culture of inclusivity across both trusts, especially with this programme, and we offer academic study to all of our recruits up to a master's level. So any registered nurse can apply. So as soon as you've got that registration in your own country, you can apply for the programme. We do ask for 1 year of clinical experience, and we ask that you are a hardworking, dedicated, and a team player. That's the nurse that we want to apply. So the minimum requirements are 1 year of clinical experience, being a registered nurse in your own country, and we do ask that you've started the process of registering with the NMC. There is no age limit, so we run a really inclusive programme, and we really encourage anyone to apply from any background, and that's what we're looking for, to bring people into this amazing opportunity that we've got. So the real key components are it's a work and earn programme. So you work whilst you learn as well. So you'll be earning a salary, working full-time whilst you complete that academic study, which is great. We support you to develop your skills, your nursing skills in the UK and your academic skills in the UK. The university and the trust lead training programmes that we will put you on. It's fully funded travel to the UK, so there's no cost to travel. Or with the NMC process, we fully refund all of those costs, so there is no cost to the nurse themselves. And we as I said, we offer accommodation, and we help support you to find somewhere to live for the 3 years that the programme runs for. Yes, so it's the work placement, so you will work full-time whilst you study, so you will be given time out of your full-time working hours to study, and you'll work on one of our wards or in one of our community areas. Yep, so family can come with you. What we do say is it's probably best to get your OSCE exam out of the way and get that registration in the UK, and I'll talk more about the OSCE exam in a second, but it's best to get that exam out of the way, because it is a very intense period, the first month or two. It's quite intense learning, so we do say bring your family after that you've become registered in the UK, just so you've got that time to focus on your own when you first arrive and time to settle in. So OSCE is the final part of your NMC registration. So as part of the NMC, you will do a CBT, which is a computer-based test, which you will have already done before you come to the UK. And then when you arrive in the UK, you'll have to sit your OSCE exam. So the OSCE exam is theory and practical based. So you will get given a scenario with a patient, and you will have to do a particular clinical procedure. Can be blood pressure, can be cannulation. There's lots of different examples of what they could be, and you get given 10 examples of that. You're then marked on how you've performed in that and whether you've done all of the steps that you needed to do. It's a very intense exam, and it's the final part of your NMC registration before you become a registered nurse in the UK. So once you've passed that OSCE exam, you then get your NMC pin. To prepare you for the OSCE exam, we have a really good OSCE facilitation team. So the team will talk you through every single scenario that we know can come up during that OSCE exam. They will work with you to practice those clinical skills, to go through the theory. We have a suite of materials that you'll get given. There's a folder this thick of work that you're asked to do in your own time, and there is online learning for 2 weeks after you've done that initial practical based sessions with our OSCE team. So we do really prepare you for the exam, and our pass rate is currently 98% for that OSCE exam. So we're really proud of how we prepare all of our nurses for that. Yeah, so all that we ask is that we can do an interview with you to just make sure that you fit the values of the trust. And once you've done that interview process, that's when we'll start those pre-employment checks. So these are standard across all NHS trusts. And once they're all complete, we will start onboarding you to the UK. So we'll start arranging those flights and arranging that transport and booking the accommodation for you to come and join us in the UK. It can take up to 3 months post-interview to do that process, because you need to get your visa to come to the UK, which we can support you with doing that as well.
Thank you, Emily, for your time and enlightening us more about the program. And for all our viewers out there who wants to learn more about the clinical fellowship program, please call our counselling team for more information and a walkthrough. See you at Amrak.